Hi, everyone. I'm Dan Choi. I am the Young Physicians Section Chair of the Medical Society of the State of New York. I have here today, we have Tom Madejski, who is the past president of the Medical Society of the State of New York. And today we're going to be talking about telemedicine and how to incorporate it, some quick tips. Me and Tom have been working around the clock to try to implement telemedicine into our practices because of the coronavirus crisis. And it's something that we've had a lot of questions pop up, and we've successfully implemented it. Well, we're learning. There's a lot of learning. It's a steep learning curve, but we wanted to pass on some of the tips that we've kind of gathered here. So Tom, how has telemedicine worked for you, and what platform are you using right now for your practice?
Yeah, so Dan, we were looking at trying to implement this down the line, but obviously that's all been accelerated with what's going on. So as the crisis started, the Medical Society and the AMA had been working to look to see what we could do to enhance this because we thought it would be useful. And through our advocacy efforts, we did get some relaxation of HIPAA that makes it much easier for physicians to use now. So you can use pretty much almost any platform. In the office, I've used FaceTime, I've used Skype, and I've used Zoom at some of my nursing facilities. And overall, it's been much easier than I thought it would be. I think the optimal solution still is if you have something integrated into your electronic record, that's probably where you want to start. But this can be done at a low cost rate. Basically, you just having those software and video capability. And to some extent, it can cut out the middleman that a lot of us looked at using for an ongoing cost to our practices.
Absolutely. So, I think that the regulations that CMS dropped recently are huge, and they're going to revolutionize telehealth because hopefully they extend it after this crisis. But for the crisis here, platforms like Skype and FaceTime, even on your cell phone, that wasn't possible before. So if you can integrate those easily into your practice, I would consider it. We, as a practice, as an orthopedic practice, we decided to use Zoom. And why Zoom was very helpful was because you can schedule individual meetings. So, already in my outpatient clinic, my appointments staff, make sure that, my schedule's blocked out patient by patient. It's very easy logistically. You can actually schedule a new meeting and design that, name it after the patient. And there's actually a waiting room in each of those visits. So the patient can jump into the call, and if I'm busy with another patient, they'll be in the waiting room and I can admit them after I'm ready. So it's really like a virtual clinic, honestly, and it's really gone very well for us. Now, I think one of the steepest part of this learning curve is not necessarily the platform. The platform is pretty easy to figure out. It's actually getting your staff and the workflow around it, and kind of educating everyone in your office on how to get patients over to this platform. How have you been doing that, Tom?
Yeah, so that has been a work in progress this week. So initially, we were using it primarily to just triage patients who might have coronavirus-related things. But we recognize very easily that it's a tool for other things as well, particularly reducing patients' need for exposure by coming to the office. We had a number of people who were canceling because of concerns about getting exposed. And while that may be sensible, it also creates a backlog of care. So we started reaching out to them, and we offered them virtual visits. The uptake has been really good. I've been able to see actually almost my usual patient load today, if not extra, because of the coronavirus calls. And patients have been pretty satisfied with it.
That's great.
I don't think it'll work for everything, but it works for, I would say, at least 80% of our needs. You're still going to need to see patients in your office, but in some of my routine follow-up patients, even the complicated ones, we've been able to accomplish essentially what we need to at our regular in-face visits.
Yeah, absolutely. I would say that in the orthopedic practice, we're converting our entire outpatient practice, a lot of it over. And obviously every practice has to tailor it to their own needs. So you can't really see like acute chest pain with this. Obviously that patient needs to go to the ER, or an infected wound, a post-op infection. It's not something that may be appropriate for telemedicine if the patient's calling in with concerning symptoms. But even routine things like patients coming in for medication refills, or I'm reviewing their MRI with them. I have the telehealth set up on maybe one laptop, and I'm looking at my imaging software on another computer. Is the way I've run it, and that's worked out nicely. In terms of kind of converting your practice over to telehealth, two barriers I've run into is, number one, getting patient buy-in is the first barrier, because you'll call a lot of patients, they hear the word telehealth, they hear the word app, or using video, and they get a little kind of concerned about that because they've never done it before. And so you kind of have to reassure them that it's going to be easy to implement, and that's why it's important to pick out a platform that you think that is patient friendly, which we have found Zoom to be. Secondly, to get that patient buy-in, you're going to need staff buy-in. So your staff, you have to explain to them exactly how the workflow is. You have to test it out amongst yourself, and you have to show them that this is actually simple to implement and easy to do. Once my partners started seeing me do telehealth visits, guess what? It was like the dam broke and everyone jumped on, and they said, "Wow, this is simple to do." So you've got to get buy-in from two sides here, and that's what I would encourage anyone who's interested in implementing telemedicine, their practice, to do. Tom, do you have any final words or resources that you can point people in the direction of before we kind of conclude this session?
Yeah, so just a comment on the workflow. Teaching the staff took about a day or two to get it sorted out. And then when they understood that people shouldn't be canceling, we should be converting them to another visit, they understood that, and that's been working well. We also reached out to our patients who would be, good candidates for this, to try and reduce their exposure. And my day tomorrow, I think, is going to be about half virtual visits and half people who are going to be seen in-house. In terms of resources, there's some great resources on the MSSNY website. In addition, the AMA has a COVID page and has great resources on telemedicine there.
Yep.
So I would encourage people to go to those two areas, and they'll have the information they need. We are literally watching the practice of medicine transform before our eyes due to this virus, and our hopefully very thoughtful response to it. So together we can do this and make it better for everybody and help our country through this crisis.
Absolutely. All right, guys, use telemedicine. We'll see you later.
Thanks.